Welcome back for another skill training. So today our skill will be giving a partial bed bath. And that includes giving a bath to a patient who is unable to or has weakness or has an order to stay in the bed, but they need to receive a bath. And as we know, skincare is very important in preventing pressure ulcers, in preventing skin impairments, and also it's a great way to make sure that we're checking the patient's skin for any signs of breakdown. As a CNA, you are the eyes and the ears of the nursing facility. So it's very imperative that you report what you see. So this is a chance to not only clean the patient, but to see if there's any signs of redness, if there are any open areas, or if there's any signs of skin death, which will be black or purple. Any of those things, anything that is not normal, not a normal skin color for that race, you want to report. So we're going to begin the skill. Prepare to start the skill. Your supplies will include a bath blanket, which we will use to keep their personal sheets clean and not wet. This will also serve as a barrier to keep them from being unshielded, so that way their body is always covered. You'll need 3 washcloths, 1 large towel. You'll also need a gown so that you can change the dirty one. You will need lotion, soap, and a basin. This will have hot water, which you'll measure with the inside of your wrist. The water temperature should not exceed or go past 110 degrees. May I come in? Hi, Mrs. Smith. My name is Wileen, and I'm your CNA for today. And I come to give you a partial bath. Is that okay? Yes. May I check your band? I'll use this time to check the band and make sure I'm giving care to the right patient. Okay, Mrs. Smith, I'm going to wash my hands, get my supplies. I'm going to close your curtain for privacy, and I'll be right back. At this time, I'll go wash my hands, gather my supplies. I'll bring them in a bag, and I'll use that bag at the edge of the bed to put my dirty supplies. I'm back. Okay, Mrs. Smith, we're going to start. Put your privacy blanket on. I will gently open her blanket, her bath blanket, and I'm going to pull the sheet down, and I'm going to do that to keep it dry so I can pull it back up when I'm done giving her a bath. Are you okay, Mrs. Smith? Okay, Mrs. Smith, I'm going to remove your gown since this is dirty, and I'm going to put it in. Can you lift your head, please? Okay. And I'm going to gently take it off. If she had a weak side, I would take it off on her weak side last. I'm going to always keep her covered for her dignity and to keep her warm. And I will gently roll it out under the sheet and put it in the bag that is waiting at the edge of the bed. Okay, Mrs. Smith, I'm going to wash your face first. I'm going to use a washcloth, one side of the washcloth, and I'm not going to put any soap on it. So I will use one corner to wash one eye from the inside out, and then I will turn this around and use that side to wash from the inside out. In the middle of your eyes, you have sacs, which you don't want to bring germs into them, so you want to wipe the germs away. So I'm going to take the washcloth, wash this eye from the inside out, turn it around, wash it from the inside out. I'm going to wash this side of her face, around her ears and under her neck. And then I'm going to do the same thing for this side. Around her face, around her ears, and her neck. I didn't put any soap on this, and the face doesn't really get dirty, so I can put this back in the water. Now I'm going to do the right side of her body. So I'm going to take my towel, and I'm going to place it under her arm to keep her bed from getting wet. Mrs. Smith, I'm going to put this under your arm, okay? To keep your bed from getting wet. Okay? So I'm going to take soap. I'm going to put it on 3 sides. 1, 2, 3, using the leaf method. So I'm going to start with her arms. That's the only part I'm using right now, so I don't need to expose her chest. So I'm going to wash her arm, always supporting it. Wash between her fingers. And then I'm going to wash up into her armpit last, because that part usually keeps odor. I'm going to fold that down, and I'm going to lift the bath blanket up. If you need to, you can take it down to wash the entire chest. You want to lift each breast, so you're going to wash horizontally. 1, 2, 3. When you get to the breast, you want to lift up and get under the folds. Under that fold, you'll go all the way down into the belly button area and stop. Okay, Mrs. Smith, I'm going to fold that down, and I can use this other side for her back. Okay, I'm going to get another one. I'm going to rinse in the same method. Do her arms, then between her fingers, up into her armpit, and then I'm going to use the leaf method to do her chest. And either I can do like this, but to be better to navigate, I'm going to go horizontally, lift this breast, lift that breast. That gives you a chance to look under the breast for signs of redness or heat rash. I'm going to go straight across to her belly button and cover her up. And I can use this last leaf method for her back. And now I'm going to pat dry with my 3rd washcloth. So I'm going to pat, 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 pat. And you want to pat dry just to keep from ripping their skin, because as elderly, they usually have thin, frail, dry skin, sometimes associated with medication use or just from getting older and not eating as much. I'm going to use the leaf method, and I'm going to pat dry. I'm going to lift under her breast, this breast, and then I can use this 3rd leaf for her back. Okay, Mrs. Smith, I'm going to turn you on your side. Can you help me turn? Okay, so I would have that side of the rail up for the hold for support. I'm going to lift this arm. Could you lift this arm, please? And put it across her chest. And can you lift your knee, please? This position helps to put the body in the natural position to turn. And I'm going to use her shoulder and hips and help her to turn. Okay, Mrs. Smith, turn, please. Now that Mrs. Smith is on her back, I'm not going to expose her buttocks, I'm just going to expose her back. And the towel is already in position to keep the bed from being wet. So I'm going to use that soapy washcloth, and I'm going to wash horizontally from left to right, all the way down. 1, 2, 3, 4. As many times as it takes you to go down to the waist. Now that I'm done washing, I won't need this washcloth anymore. I'm going to put it in my soil bag. And now I'm going to rinse in the same way, horizontally, from left to right, from top to bottom. And now I'm going to pat dry with my 3rd washcloth. That in the soil, and if the back is still too wet, I can use the towel that I had on the bed and take those ends and pat the back dry. Okay, I am done with that. So I can take this and put it in my soil bag. And now I'm going to take my lotion, put it in my hands. You're never going to take the lotion and put it directly on the skin. I'm going to warm it up. And I'm going to rub the back in a circular motion from bottom to top. So I'm going to go 1, 2, 3, and I'm going to go back down. 1, 2, 3, and do 3 runs. 1, 2, 3. This helps increase circulation, brings blood flow to the back, and that prevents pressure ulcer. It helps to prevent pressure ulcers, along with turning and repositioning them. So I'm gonna take my warm lotion and I'm gonna rub from the bottom. 1, 2, 3. 1, 2, 3. 1, 2, 3. Okay, Mrs. Smith, we are all done. I'm gonna lay you back. Could you lay back, please? And now Mrs. Smith is going to lay back. So now that I have her nice and clean, I'm gonna put her clean gown on. And I'm gonna put this on the top of the bath blanket because the bottom of it may be wet from giving her a bath. I'm never gonna throw my clothing. I'm always gonna spread it gently. And if she had a weak side, I would put her clothing on that side first. I always reach in the arms and give them a handshake to pull their arms through if they don't have weakness or paralysis on that side. And I'm going to do the same on this side. Now I can remove my bath or dignity blanket, whichever you prefer to call it, because she is all covered up. I can tie my gown. Mrs. Smith, can you lift your head, please? I will take my sheet and cover her back up. You always want to leave your patient in a position where they are clean and well covered. At this time, if you're going to leave to take her supplies, you would put her bed down. Put your bed down. And I would say, okay, Mrs. Smith, I'm all done with your bath. Here's your call light. If you need anything, call me. I'm gonna put your bed down. I'm gonna open your privacy curtain. I'm gonna take my supplies, wash my hands, document, and my skill is done.